Okay, good evening, everybody. Welcome to the first meeting of the new municipal year for the Health and Adult Social Services Standing Scrutiny Panel. And that's a mouthful that I try not to repeat again. It's very nice to be doing this in person for the first time in a while, certainly for me, for the first time in 4 years. But we are a hybrid meeting this evening to allow members and officers to fully participate in the process, and I envisage that it will be a hybrid meeting for a significant portion of this municipal year. I am Councillor Daniel Crawford. I'm the chair of this panel. As it is a hybrid meeting, we have some members present in the chamber. We have some members present online via Zoom. This meeting is live. It will be recorded. It is available for viewing on the council's YouTube channel, which is at youtube.com/user/Ealing Council. And the agenda papers are accessible online via the council's website. And that means that we should be able to have people participate remotely as they have been doing through the pandemic. I'm still waiting for a couple of members to join us in person, but I'm assured that we are quorate and we can begin the business of the meeting. I do have apologies from Councillor Faduma Mohammed, who can't be here this evening, and we will have her back when she is able to join us again for the next meeting. I'm not informed of any urgent matters. Item 3 is declarations of interest, and that requires me to ask any member of the panel to declare any interests. And in good fashion, I'm going to start as the chair. The panel, as when we get to the work programme, will consider social care as a key part of our work this year. I need to inform both this panel and the council and the members of the public that from 2004 to 2008, I received a package of social care that was partially paid for by Ealing Council, partially paid for by Devon County Council, partially paid for by Exeter City Council, in respect of me attending the University of Exeter and having full adult social care whilst I was there. That predates my time serving on this council, but I think it's important, given that I am probably going to be expressing an interest in social care during the course of this work, and I have personal knowledge of its operations within Ealing, that I declare it. I have not received a package of care whilst serving as a councillor, but due to the degenerative nature of my cerebral palsy, it may become something that I will need to do on a temporary basis, and I will declare that as and when appropriate. I have been assured that this is not a pecuniary interest, and therefore I can continue to chair the panel. But obviously, if colleagues think that is inappropriate, I shall step aside. There may be other members of the panel who need to declare interest. I'm going to start with Councillor Wesson.
Yeah, I'd like to declare an interest. In my day job, I'm head of customer inquiries and complaints at the Nursing and Midwifery Council. I think this would only become a potential conflict if we were considering matters in relation to nursing and midwifery.
And I don't think we will, but I appreciate your declaration. Councillor Conti.
Declare that I'm a GP, though I don't work in Ealing.
Thank you, Councillor Conti. Councillor Mataza.
Yes, I work as a general practitioner and a pediatrician. I have a practice in Northolt and one in Acton. I have another partner, and I have been working on the Ealing CCG. I was elected executive board member when Ealing CCG was found. I am a member of Northolt PCN, but other than that, nothing.
Thank you. It's just important for transparency that we declare all of those, and you've done so on your register of interest. So I'm assured that's not a pecuniary interest. and that you can continue to participate in these meetings. I need to ask if any of our councillors who are joining online have anything they wish to declare at this point or need to declare. And I just need to see if anyone's indicating. Jack can tell me if anyone's indicating. No? Lovely.
No, Chair.
Thank you, Councillor Cordier.
Thank you. You can
Nice.
have a voice.
Nice to hear from you. We can always, if people find out that there's something they need to declare, they can declare it as and when, and we'll revisit this in future meetings. But thank you for that business. There are no matters to be considered in private. We do have some minutes to approve, but I think only Councillor Conti and I and Mr. Cook will be able to assess whether these are an accurate record from March. There is one change we need to make on page 7. The minutes refer to the Ealing Community Trust, and we need to refer to Ealing Community Transport in delivering the COVID vaccine, which is obviously very important. We need to do that. But other than that, I'm satisfied that these are a true and correct record of that meeting, but I need you to agree that that's the case. Thank you, Councillor Conti. Is there anyone who has any other objections or corrections to those minutes? No. No?
No.
Thank you very much, colleagues. I will sign those minutes in due course, and thank you. Item number 6 then are the panel's terms of reference and the work programme. So the terms of reference outline the membership, general functions and specific powers of the panel, and it's our purpose in this discussion this evening to set the parameters for our work for the year. The terms of reference will need to be agreed by the panel, and they will be binding for the course of the year, but the work programme is not binding for the course of the year. It is indicative at this stage. What I need to say about the terms of reference is that it's crucial that we agree our co-opted members, and I will ask them to introduce themselves briefly in a moment. But it's proposed that Daniel Norman, the operations manager of Healthwatch Ealing, takes over as the Healthwatch co-optee. We've had Healthwatch co-optees since the institution of Healthwatch, and they've all added a great deal to the work of the panel. Mr. Alan Cook has been a long-standing member of the panel. I won't embarrass him by saying quite for how long, but colleagues can work out that we both joined this panel at the same time. And I'm very grateful for Alan for agreeing to continue to serve for another year. He gives an excellent independent view on health matters right across the borough. And we will have a representative from Ealing Community Network to succeed Piotr, who has stepped down. For this meeting, it's Fayaz Dar, who is with us this evening, the General Manager of Ealing Community Transport. For future meetings, it will be John Chesters, the new CEO of Ealing Community Transport, who can't be with us this evening. Fayaz, you're very welcome, and thank you for stepping in. So I think the first thing to do, if I could ask each of those individuals to identify themselves and say a few words, because we're an entirely new panel. Councillor Steve, come and sit up here with me. Thank you. We're largely an entirely new panel, apart from Councillors Conti, Steed and Cordier. So if I could start with Mr. Cook.
Thank you, Chair. I've been involved through Link and Healthwatch in Scrutiny panel for a number of years. I hope I bring an independent view to what is going on and represent the public as best as I can.
You do, and your candour is always appreciated, Alan. Fayaz, would you like to introduce yourself from Ealing Community Transport?
Hi, I'm Fayaz Dar. I have been with Ealing Community Transport now for 7 years, but in this role for just over 5 months as a general manager. And I'm very passionate about what the services Ealing Community Transport provides to the community itself, and look forward to doing more of it.
Thank you. And as we mentioned before, Ealing Community Transport was pivotal during the pandemic and probably beyond for lots of our residents. And we're very grateful to have such expertise and passion here with us through yourself this evening and through your colleagues through the year. Daniel Norman from Healthwatch is joining us online, and he's there on my screen. Daniel, would you like to say a few words about yourself and Healthwatch?
Thank you, Chair. My name is Daniel Norman. I joined Healthwatch Ealing as the operations manager this April. Spent quite a few years in health and social services in this country, including 5 years as a nurse. I just hope I can make a contribution that's worthy of the panel.
Oh, you certainly will. I'm sure of that. So thank you. We do need to approve those 3 members as co-opted members, or they can't be co-opted members. I'm not going to ask for a vote. I'm just going to take acclamation here, and most of the members in the room are nodding. Can I just check that there's no objections from people online?
Agreed, Chair.
You agree? Thank you, Councillor Cordier. Yeah, I'm going to take that as agreed because people are agreeing with me vociferously. I do want to take some time just to go through the terms of reference for the new members and for everybody really in the interest of good governance. Don't worry about that. So the terms of reference are largely unchanged really. We do have powers to it says here question members of the cabinet. I'm not sure we'll do it quite like that. But to scrutinise effectively health procedure, policy and practices, to assist the council and cabinet in development of its budget and policy framework. But clearly our biggest power is to consider and make recommendations to relevant bodies regarding things that come to our attention. And to propose areas for improvement review or value for money review and scrutinise implementation of any action plans. So we do have powers to work very closely with the local NHS, which we've done over a period of years, and health partners in respect of the council's public health agenda. And we do have powers through the National Health Service Act and the Health and Social Care Act of 2012. So the chair and vice chair are nominated as members for the JOSC, the North West London Joint Health Overview and Scrutiny panel, which meets to discuss the North West London proposals on a sort of quarterly basis. The rest of the work, the terms of reference, go into how we will do that. So we will mainly do that through these meetings, but there will be times when briefings are asked for and circulated to members outside of these meetings. I, as the chair, will always try and facilitate any requests for information from members of the panel and indeed members of the public. And we try and do that, but we can also go on visits to various things, both within Ealing and outside of Ealing. And I do intend to do as much of that as possible to showcase the good work that's going on across the borough. And in respect of social care, which we'll come to, there may be some visits we make to other boroughs or other places to look at how other councils and other authorities have reshaped their social care that may be of interest. But all of that is to be determined by yourselves as members of this panel. It is not my prerogative to decide what we do. And I don't want to. I want to consult with you all. So those are the terms of reference. They're largely unchanged. I need you to agree those terms of reference, please. So can I ask if anyone's got any objections to us proceeding on that basis? No, in which case I'm going to take those as agreed unless someone shouts at me from our online contingent.
Agreed.
Thank you, Councillor Cordier. The next bit is the work programme, which is on page 27 of the bundle. So it is proposed. I'm just going to take you through September's one because this work programme will come back to you every meeting. And myself and Councillor Steed, as the chair and vice chair, will have a meeting with officers and relevant people prior to the next meeting to discuss exactly what we would be looking at. And I would solicit contributions from all councillors on how a report should be shaped, or if there's an area that's missing or something that you would like to include. So this is an indicative work program that we've worked out on the basis that we're going to take some time to examine social care and how we fix social care, in the ambitious words of the Ealing Labour Party manifesto, because it will take a couple of meetings and then we can move on to more important matters. But so the next meeting in September will take a report on access to GP service and the progress towards the Ealing Care Standard. That was something that's held over from the previous year's operation, but is no less relevant presently. A report on Ealing Hospital, because many services are returning to Ealing Hospital now. A report on mental health services in Ealing, and then a report, the Health Watch Patient Experience Report. And obviously you see there at the bottom, the panel's work programme will be considered at that meeting again, and so on. Everything else is indicative and open to change from anyone who wants to change it. So again, I do need you to agree that work programme initially so we can proceed with this meeting, but it's open to revision from anybody. So unless anybody has any strong objections, I'm going to proceed. Thank you, everybody. Right, so let's see where we've got to. My list of things. Yep, lovely. So what we're going to do first is take our public health report, which is going to be provided by Ealing Council's Director of Public Health, Anna Bryden. Anna has regularly updated the panel on public health and specifically COVID within the borough, but there are a couple of other items we've asked Anna to cover. She's going to do a presentation for us and speak through the slides that she's prepared, take questions from members of the panel, and then we'll move on. So we may have a little bit of interference, and Jack is helping out. That's all right. No, we're all good to go. Anna, when you're ready.
Thank you, Chair. Sorry. I'm trying to set my video up so people can see me to say hi, but it's not coming up for some reason. So I'm just going to be a very tiny person on there, if that's okay. So evening, everybody. Nice to see everybody in person, and nice to meet some new members of the panel. As Councillor Crawford said, I'm Anna Bryden, Director of Public Health. I've been here a couple of years, started mid-pandemic, so that was fun. But really, really good to be here. Councillor Crawford has asked me to run through just some brief slides. You've got them in your pack, so I won't go through every detail in there, but obviously happy to take any question. Let me just try and share my screen. Give me 1 second, apologies. This is where the IT fails us, isn't it? I'm pressing the buttons and it's not coming up for some reason. Sorry, Chair, just 1 second.
Jack's just going to come and see if we can help, but we do have other devices on which share screens if need be. Do we need to allow her to share a screen? Yeah.
I can start talking through it if that's helpful. I know members have slides in the pack.
Yeah. Who will need to see what you're referring to. So let's just see if we can get that all sorted. Anna, is there any way you could? Yeah, brilliant. All right, and this is the moment at which a nervous performer says, "Talk amongst yourselves" or something.
Sorry, Chair. 1 second.
It's all right. We can just be patient. We'll get there in the end.
Apologies, it's got the share screen button, but it's not doing anything. I can start talking.
Technology is brilliant until it actually works. So what we're going to do is someone is going to share their screen with Anna's presentation. And I think we're almost there on that score.
Great, we can see that.
You can see that. Thank you,
Yes,
Councillor.
yeah, it has come up, yeah.
No, just wait a minute. We've got to let this get through the security update. Right, we're ready to go. Anna, over to you.
Thank you, Chair. Apologies. So this is really just for the panel to give a bit of a flavour of, I suppose, what public health is for those that are newer to it, and running through a lot of our key strategic priorities. I think you'll really see it's very much partnership work, so across lots and lots of different council departments, NHS, voluntary sector, etc. Oh, thank you. Thank you. Just this first one is just a useful diagram, which I always come back to, which really just shows the different aspects of public health. So from the middle, you're talking about, you know, individual factors, moving out to kind of lifestyle and ways people live, diet, smoking, etc. And then really influencing all of that. You've got social community networks, for example. Have your family and friends had the COVID vaccine? Is it usual? Is it seen as acceptable? And then going over into kind of much wider determinants, so housing conditions, do you have safe employment, etc., and then much wider kind of cultural conditions, socioeconomic deprivation, etc. So I think it's just really important when we're talking about public health and health outcomes, just to think of everything in the round, rather than kind of everything being, you know, individual choice. There's so much that the council does as a whole that influences all of these health and wellbeing outcomes. Which is why the partnership work side of public health is so key. Next one, please. So just a couple of examples here. Life expectancy. So for people who are born now, how long are they expected to live? You see this very starkly between the most affluent and the most deprived areas, 2 or 3 year gap. When you look at how long people live in good health in their older years, that gap's there as well, and more pronounced. And a lot of those are related to things like heart disease, lung cancer, etc. So, you know, some really preventable factors in there, coming down to all of the determinants we just talked about. Next one, please. And I'm not going to go, this is a very busy slide, apologies, I'm not going to go through this in detail, but I think just the visual map on the left is really, really key in terms of looking at deprivation levels across Ealing. You'll see the areas that you're all familiar with, South or North or Acton, etc. If you map on ethnicity, language spoken, some factors like diabetes onto this, you'll really see the overlay. And we saw that with things like, you know, those inequalities with things like COVID came out so strongly, really shone a light on it, in terms of people from those more deprived areas, people from areas that are more diverse, more likely to end up in hospital with COVID, have poorer outcomes. And that's a number of factors there. It really kind of shows those wider determinants. So it's not, you know, that some of those people might be in poorer health already for, you know, long-term conditions like diabetes, more crowded housing conditions, having to go out to work rather than isolate because they don't get paid otherwise, etc. So really shone a light on those. Next one, please. These next 2 slides I'm going to go through really quickly, the details in your packs. This is just an outline of the services that the council's public health department commissions. So we've got the budget and the responsibility of oversight of these. So our 0 to 19 Healthy Child programme, that's things like health visiting, school nursing, etc., is obviously a really key one, and links in a lot with our children's centres and our local schools. We've also got oral health promotion for young people and female genital mutilation service, and awareness raising. Obviously relatively small, but a really, really crucial service for us. Next one, please. We've also got some more health type services, so things like regular health checks for people who are 40 to 75 every few years, just you know, really preventative, finding issues before they become more of a problem, things like high blood pressure. We've got our 2 big services, our substance misuse services and sexual health. There's lots of services involved in there, and there's some details there. I'm very happy to take any questions away on those. so some stop smoking services across London, mostly telephone support. We are looking at whether we might be able to do something very targeted here and working with our NHS colleagues, especially in terms of, say, people that are pregnant. And then again, TB, we are one of that. We have got one of the highest rates in the country in Ealing, and particularly targeted at areas like Southall. So there's some really good awareness programs there and a lot of community engagement. So just moving on, this is really just a brief overview of the kind of big strategic priorities for this next year, I think, for the panel to be aware of, and obviously can come back and talk through some of those at future meetings. We've got the new Health of the Borough report, which was in the manifesto of the council plan, really looking across the council at what we all doing across the different departments to improve health and wellbeing of residents. There's lots of things in there about regeneration, air quality, etc. I'll come on to a couple of these in a bit more detail in a moment. One of the really big things for us this year is developing the health and wellbeing strategy. Happens every 5 years. So this next few months is a really big opportunity for that. And there's a lot of examples there of how we work very, very closely with our NHS partners. Next one just pulls out a couple of these just for interest and awareness. Health and Wellbeing Board Strategy we've mentioned. It's a really crucial document and an opportunity to lever in some good joint working about how we do things better together. And the focus of this year's strategy is going to be on inequalities. So a lot of that coming out of the kind of COVID work, where can we make those kind of structural changes and commitments jointly together across the system. So timeline for that is really doing a lot of engagement work between now and about September, and that will be coming back to scrutiny in April of next year. Air quality is a big one. Lots of areas like Acton and other areas, you know, there's a lot of big roads going through the borough, etc. A lot of urban areas. There's a lot of really good work that the council does on there. And we've got the links in with health service as well about sharing, say, alerts if there's high pollution and people have asthma, etc. We're also looking at something called school super zones, which sounds very funky, which is essentially putting essentially a circle around each school and really looking at lots and lots of different factors that you might be able to influence. So things like healthy options at local shops and takeaways, air quality, roads, no idling outside schools, etc., etc. So that's something we're looking to put a bid in for some London funding later in the year. So that's a really good kind of partnership approach. Let's Go Southall, a lot of you will have heard of over the last few years. Fantastic opportunity we've got in Southall, really community driven. It's not even engagement, it's far above that in terms of actually the communities taking forward a lot of their work and really improving the opportunities in that area. So lots and lots of learning for us there about how other areas can do similar initiatives. And then just one we wanted to mention, I actually had the meeting this afternoon as part of the integrated care partnership work or borough-based partnership work, which I'll come on to in a minute, which is our links with NHS and voluntary groups, etc. Is a group I chair on population health and inequalities. It's really a group that holds a lot of the topic areas that don't naturally sit anywhere else. So there's really big juicy areas like climate change, homelessness, health, substance misuse, and a lot of the data stuff as well. So really working with our NHS colleagues on how do we dig down and do pilot some approaches to really support people in the whole. So not just looking at people if they've got diabetes or they smoke or something, but actually going, we've got this cohort here in these group of practices. There's pilot, for example, in Southall. They've got mental health conditions, smoking issues, concerns about employment, etc. What can we put in place around them to really support them and look at them in their widest sense? And there's going to be an engagement and communications group across the system forming, which I think will be a really good group to kind of oversee that and plan ahead together. So again, something we might bring back here at future meetings. So just moving on, I mentioned health and wellbeing strategy. I suppose one question for the panel at the end of this presentation is just how might we best engage with the panel? Obviously, don't just want to copy you into things we send out in terms of community engagement, but just thinking over the next few months how we might best do that would be really good to hear from panel members. Next one, please. I couldn't do a presentation without mentioning COVID. So on the left is just some of the kind of principles that the government set out in terms of protecting people most vulnerable, encouraging safe behaviours, etc. On the right is just a really good summary of the kind of things we still are doing. It's not gone away and we're not ignoring it. We're doing a lot of really good positive work around engagement at the moment. We got some great funding from national government around community vaccine champions. That's really broadened out just into kind of health and wellbeing champions. We've pushed forward a lot with the young people's part of that and some intergenerational work. So there's been great examples of our young people's champions going into schools, youth centres, etc., drama approaches, workshops, going to events, and that's really been pushed forward and really good enthusiasm there, and including from parents as well. We're a little bit further behind with the adults side of that, but we're building on what we've already done. We had a community engagement organisation called Each working with us in the council over the COVID pandemic. They really got out there and worked with a lot of individual small organisations and individuals who are volunteers, and so we're really building on pulling that together and giving people the support to be champions going into the future. So that's something we can definitely bring back here. Where also Health and Wellbeing Board is leading on a lessons learned review from COVID, especially around how we work together as partners and how we can do better going forward. A lot of work obviously still happening around vaccinations, and health inequalities. I think is just really useful to mention here. Obviously things like the lateral flow tests, the rapid tests that people have as a home kits stops being provided for free. There's obviously massive inequalities with that. So we're doing what we can while we still have a small stock in our council in terms of still supporting things like the food bank, some voluntary sector organisations, etc., some of our frontline social care workers, really to try and support that work going forward. Vaccination is a massive area of work in terms of inequalities. There's been so much good learning over the pandemic about what we have and haven't done well, and where we can really see that going out into communities, really engaging with things like homeless charities. We had our NHS staff manning stalls in Acton at the market to pull in market holders for vaccinations and get them going out and telling people about it. So, you know, there's really good examples out there, and that work's not going to go away. That's long standing. In a minute, I'm going to skip over the next slide, but the one thing I did want to pull out from it, some of the COVID data, is just a percentage of people who are still unvaccinated. We've still got 30% of people in Ealing that still haven't taken up the offer of COVID vaccinations. There's so many reasons for that, and that's the whole presentation in itself. But I think it's just really important that 30% isn't going to go down quickly, and it's been 30% for quite a few months now. One thing that's been really interesting, we've had a research team working with us in Ealing, which has been fantastic, both with young people and adults, really going out into communities and talking about why people have had their vaccination or not. And, you know, I think even looking at things like circles of trust, so finding that in a lot more of the deprived, more diverse areas, especially for young people, they're trusting maybe 4 or 5 people, friends, maybe youth worker, maybe someone from school, maybe a parent. But actually when you go out into more affluent areas, they're talking about listening to Chris Whitty and listening to the GP and things like that, much broader areas of trust. And it's just really useful information for us, not just for COVID vaccinations, but for lots of things we're doing in health and wellbeing. So there's still lots of busy work going on with COVID and things we can update going forward. So just moving on to the next one, please, Anna Marie. So COVID's not gone away. We've now got monkeypox. It's a virus that can be prevalent in some areas of West and Central Africa. You do get a handful of cases every so often in the UK and other countries. For reasons that aren't particularly clear, we've got a bit of a flurry of cases going on here in the UK, not just here in places like Portugal, US, France as well. We're now up to about, I think it's nearly 600 cases in London that are confirmed. There's, I think, a bit of an expectation that that might be a tip of the iceberg in terms of just cases coming forward. You can have quite mild symptoms, especially at the beginning, and then develop a rash. Again, for various reasons, the majority of cases in this particular outbreak are in men who have sex with men. not necessarily through sexual contact, but just, in households, etc. One of the big impacts for us locally, just to be aware of, is our sexual health service. If people have got a rash, they are being advised to go and see their sexual health service. Our service has had to go back to almost its COVID measures. So people have to ring up by phone. They can't just turn up, deep cleaning, PPE, etc. So that is really putting a strain on our local system. We haven't had loads of cases locally. There's a lot more central London, but we are starting to see impacts potentially on some schools in London in terms of isolation. And again, going back to COVID and inequalities, people who have been in contact with somebody with monkeypox need to isolate for 3 weeks. It's a long period of time. People might not be able to work. People might need emergency accommodation. So we're working through those processes locally just to work out how we can support our local residents. And then the next 3 slides I'm going to go through briefly. They're quite detailed and very beautiful. These are from our NHS colleagues. So a lot of you might have heard of integrated care system, integrated care partnership. It's the governance system that NHS is moving into and has been moving into for the last couple of years. Formally starts in 2 days on 1st of July. We have this is our Ealing picture on this slide. We have what will be called from 1st of July our borough-based partnership. We've had really good relationships, especially through COVID, with our NHS partners, and that's just strengthened over time. There's a lot of shared priorities there. There's a lot of real commitment in terms of inequalities, looking at population health, etc. So that borough-based partnership board reports to some extent into health and wellbeing board. And there's various subgroups under that look at different priorities. So, for example, I chair the one on population health inequalities. We've got a couple of children's groups, adults integrated care, and older peoples as well. So a lot of our work is now under that structure. That's working well at a local level. Excuse me, if we just move on to the next one, please. So this just looks, it's a bit of a complicated slide, but it just looks at the bigger picture. So our Ealing work sits within now what is a North West London integrated care system led by a board. There's also an integrated care partnership at that North West London level that includes some council representation. And that really is looking at what we can do best across that bigger footprint. And where the partnerships are, there's really good people working at that North West London level, especially in terms of some of the inequalities we've talked about. I'm just about to start sitting as Director of Public Health Rep on a racial inequalities, structural racism working group at the North West London level. So really interesting to bring that learning back to Ealing. The links between our local Ealing level and that North West level are still being formed. I think it's fair to say there's a lot of complicated groups to link in with, but there's a lot of good positive progress being made there. Slide 15, I'm just going to go through really briefly just some of the priorities that are coming out of that North West London level work. So for the Integrated Care Board, there's a lot of things in there I think we'd recognise as important for Ealing, especially in terms of things like inequalities, value for money, etc. And really interesting to think about this like broader economic and social development. So we're not just looking at NHS services. This really is looking at kind of health and well-being across a whole, and a lot of the enablers as well, especially things like digital exclusion, what data we can look at, and estates across, including Ealing. Where can we better use our estates between us all? And then just final slide, this is just a few nice pictures to show you things we've been doing recently. Now we've got Let's Go Southall doing really big cycling initiatives, and that's going to get huge over the next few months. We've had some dental and oral health promotion for children, which was one of the local schools here. It's absolutely raining very, very heavily, but really good engagement with families, really keen. Lots of children identified that really needed dental care and were accessing it. We've got the massive vaccination events we've been doing locally, and I think World AIDS Day is mostly red at the bottom. That's all from me. Just wanted to say in the pack, there's also 2 slides below this. They are some principles and ways of working to reduce inequalities that have come out of the COVID work we've been doing. So really looking across all of the different impacts of COVID. And we've written that up as our annual public health report, which I think was circulated with the last minutes. They're just really useful principles for us to be aware of as a panel, and we're going to take those forward into the health and wellbeing strategy development. Thank you, Chair.
Thank you, Anna. I was guilty of asking Anna to pack an awful lot into that presentation, but I think it was important to set a broad direction for the year in terms of the public health priorities and some of the things that we've asked for. So what we normally do is ask for questions from members of the panel, and then we move to recommendations. So keep your hands up, those people who are in the room. So I've got you all. We'll start with Councillor Conti, and keep your hands up so I'm writing them down.
Thank you. I just wanted to ask about sort of sexual health priorities. It was just something I was reading a while ago about. There's like the target 0 to reduce the number of new HIV transmissions by 80% by 2025. And I was just wondering, so there's no, obviously I know there's lots of things mentioned here, but I was just wondering, is there anything that locally, does anything locally feed into that? And I guess what are Ealing doing about that? And is that something, because 2025 doesn't sound like a long way away, and reducing by 80% is a huge number. So I was just wondering if there is anything that's happening locally on that. And I guess the other thing was also on sexual health was, obviously you're talking about the challenges obviously monkeypox is placing on the service. I saw one of the things here is sexual testing through the post. How's that being promoted? It's not something I've ever seen promoted anywhere really. It was just like what's the uptake of that like? Because obviously that can help to relieve the more routine things, relieve pressure on services.
Thanks, Councillor Conti. So yes, there's, I might come back to you with a more detailed answer written, if that's okay, but I'll give you a high level answer now. Yes, there's lots and lots of local work and London work that we are partly funding in terms of that target 0. We've got a local charity organisation that we work with in terms of HIV awareness, testing, etc. So going out to community centres, schools, etc. Our local service, the main sexual health service, obviously helps to reduce HIV transmission, etc. I was going to mention the e-service, but I'll come back to that in a minute. And the other thing that's been amazing and only started, I think, about a month ago was that in A&E services now, people need to opt out of HIV testing. So if you have your bloods tested for any reason, you need to say if you want to opt out of HIV being one of those tests, along with lots of other things. That's been something that we've been talking about for years, and it's fantastic that that's finally kind of come through the system, and that culturally we feel it's something that's able to be rolled out in the NHS generally. In terms of the e-service, that's something actually I was very involved with a few years ago, setting up across London. Again, going back to what you're saying about freeing up services so that people being seen in person by the experienced consultants, etc., are the cases that really need to be. If somebody's just got some very minor symptoms, etc., we've commissioned across London what we call the London e-service or London Sexual Health. It's really going well. It was going well before COVID. COVID really pushed it into another scale to the extent where our budgets are actually getting quite tight for it. It's a good thing, I say, without a director of finance here. It's really great that people can use it and use it regularly. There's a lot of people, say if somebody has more is more high risk, or young people, etc., just using it regularly, using it when they get together with a new partner, etc. So that's really going down well, and the evidence I've seen in terms of how the evaluation is really, really positive, really good feedback on how it works well. It's been expanded. There's even some very low level contraception now available on it, etc. So that's really growing over the years, and there's a lot of really good safeguarding tied into it. That was one of the concerns when we started it off from a lot of people, but an awful lot of work was put in to ensure that. And actually, if anything, it's come out as young people actually trusting it more almost, and being comfortable talking to somebody on the phone or on the online system rather than going into service. So that's doing really well. In terms of how it's promoted, unless anything's changed recently, it was never meant to be leaflets everywhere and posters everywhere. It was very much if people were engaging with sexual health services, school nursing, things like that, that people would know about it. But there is a lot of work done across London about advertising it on tubes and things like that. The same with a lot of the HIV services across London. There's something called Do It London. If you go on tubes, you quite often see posters and things for that, and obviously in a lot of venues as well. It's it's promoted there, but I'm happy to share more details if you'd like.
Thank you, Councillor Steed.
Thank you, and thanks for the slideshow. A lot of information there, and a lot of very useful information. I've got a couple of questions, if I may, Chair. Some quite short things, but some may involve you coming back. One of your first slides about the life expectancy gap, and I just wondered what the direction of travel is on that. I don't know whether you've got that information in hand, but I mean, it's just quite a
Do
simple
we want
thing.
to pause and let her answer each one individually?
Yeah,
And then, yeah.
Can do, Councillor Steve. So it's getting worse is the answer
Okay,
generally
which is
across
what I
the UK.
suspected, actually, yeah.
Yeah, and it's some of the life expectancies across the UK that have been rising year on year have slightly dipped in the last year or two, and that gap is getting bigger on the whole. But yeah, I can share some information.
Okay, slightly bigger question, which to some extent might be useful to speak to when the officers from the NHS come along. But on those slides, those very busy slides about the ICB, you mentioned one thing in your speech about how it's now less, I was going to say less service orientated, but perhaps that's not quite fair. It's broader issues are being addressed rather than it being just a service provider kind of thing. I mean, is that the main difference you see with the ICB compared to what you were dealing with before? Because initially, one thinks, well, this huge transition which has taken place, which must have been pretty expensive in itself. But I mean,
Yeah,
is it
You
just
don't have to comment on the expense of it. Thank you.
okay?
From where I'm sitting, I say
Yeah.
yes. Obviously, I'm relatively newish to Ealing, but even from where I was before, just seeing the journey over the last few years, we're having conversations between us that always were, oh, that's a public health thing, or that's an NHS thing, or anything like that. It's now being seen as very much shared commitment to these things, and really, I'm in meetings, and I'm not the only one sat there sort of talking about inequalities and things. I've got loads of NHS colleagues doing that for me, which is great. So lots of really good champions out there.
And at this stage, it may be too early to say, but what's the implications on the total budgets they've got and stuff like that?
I don't know the answer to that, but I can check with Neha and come back. That's okay.
All right. I've got one last
Yeah.
question, if I may. You mentioned about home kits for testing, and maybe quite useful with having Councillor Blacker in the room at the same time. Some local authorities, I believe, are funding home kits as opposed to just using the stocks that they have, but ongoing funding commitments. I wondered whether that might be something of use.
So you might want to come in this in a minute, Councillor Blacker. As far as I know, and this was a few months ago, I haven't heard it more recently. As far as I know, there was only, I think it was Portsmouth that was looking for it. I don't know the reasons behind that. We did have a look at costs. They are high. And we were really saying, I think our local decision, along with the rest of London, was essentially national policy is XYZ. We have always followed that all the way through with COVID. We had quite a good stock here, and we are trying to use it as well as we can. So not just universal testing, free for all, come and collect it, but really to reduce inequalities and help those who really wouldn't be able to afford it. From an ethics point of view, it's a difficult one,
Sure.
But it is national policy.
What I'm going to do is I'm going to ask Councillor Blacker to come in before I let you come back, Councillor Steed.
Yeah, I mean, I think as Anna says, the costs are so prohibitive. Our approach has always been that targeted approach, and the stocks we've got left will be targeted where they're most needed. We're not going to fund things that the government should be funding with money that we don't have. The end of testing came very abruptly. And the way they've managed the COVID funding is such that, you know, they often make decisions at last minute without telling us as well. So we wouldn't have even had time to factor it into the budget for the next year. But you know, it's that focus on inequalities and actually the prevention again. So, you know, knowing you've got it or not doesn't matter as long as you've had your vaccine, as long as you're boosted, and you can kind of, you know, have a much milder course than otherwise. And on that note, I think just worth looking back at what Anna said about the community vaccine champions and that program, because that's where we're going to make the biggest difference. And watch this space in terms of, given government are no longer funding it, what we can do to keep it going.
You're looking like you want to come back, Councillor Steed. I'm going to indulge you because it's the first meeting and I'm feeling generous.
Thank you. No, I get the point about government decisions being made at the last moment, virtually all through the whole COVID exercise we've gone through so far. But having said that, yeah, I mean, Anna mentioned about still 30% of people unvaccinated and stuff like that. I just wonder how long the tests that we have, how long will they last now? I mean, are we talking weeks, months, whatever? You respect, you both mentioned the cost of this. I just wonder what the costs actually are.
I can come back to you on our supply lasting. I think people have been using it less than we thought they would. So it is lasting a bit longer. In terms of costs, I would have to come back to you. I think at one point Boots were selling a single one for £6.99. And I think it was a 5-pack for £17. And commercially, we did have a look with some of our local partners on that, and it was coming out similar if you buy them bulk. So it was expensive when you start talking about especially universally. It's a lot.
Slacker, would you like to come in, or do you think that's okay? Yeah, so I think the steer we get from this is what we've heard from colleagues, but I know these decisions will be kept under review, especially if we go back into a situation where there is more exposure to COVID, and we can certainly look at some of those inequalities and issues going forward. I still have a lot of colleagues who want to come in. So Councillor Weston was next, and then I'll take Councillor Matthias.
Thanks very much, Chair, and thanks, Anna, for that presentation, and nice to meet you as well. So I've got 3 points that I wanted to raise, sorry, but I'll do them all at once so that you can come back on all of them. Just wanted to ask in relation to polio, because obviously that's something that has cropped up in the news recently, small number of cases in London, wondering what we're doing to kind of encourage people to get vaccinated that haven't. I'm also aware that that's putting pressure on some GP surgeries that are actually receiving quite an influx of queries about sort of historic vaccination records for people that don't know if they have been vaccinated. So just interested in your thoughts on that. And then in terms of the 30% of people that haven't been vaccinated in Ealing, obviously that is a concerning statistic. I know from an article that I was reading this morning that the notion of these kind of pop-up vaccination centres is something that South Africa did a lot of, and they actually looked at taxi ranks as a potential place for them. So just wondering whether that might work as a suggestion. And then finally on air quality, obviously a big concern for residents in my patch in Pitshanger, very close to the A40, and just wondering, I know that some other local authorities across the country have looked to enhance their planning guidance over and above the provisions set out in legislation around measures to improve air quality, and just wondering if anything like this exists in Ealing.
Thanks, Councillor Weston. So let me start with polio, which is not a phrase I'm used to using. just, I suppose, a bit of reassurance. So some countries use a older style vaccine, which we haven't used here for a very long time, and a lot of countries don't. And so the thought is that somebody has had polio symptoms arising from a live vaccination, which can happen rarely, and has been passed on within their household potentially. So finding that in the water system and the sewage system doesn't mean it's out there widely. It could just be from a handful of individuals linked to one person, and so it's quite contained. I think there is just a general concern that it's another good opportunity in a way to reinvigorate and reinforce a lot of our vaccination work. So we are working a lot with our NHS colleagues on this at the moment, and it literally the last couple of days. So if you're happy, I can get one of my colleagues to send a few points over to the panel, and we can share that. It's also as part of our wider vaccination plans for childhood. Again, it comes back to a lot of the inequalities we talked about, a lot of the same groups in terms of trust and understanding of the local NHS system, language, etc. I haven't heard so much about the pressure on GPs, but I can imagine, you know, my husband asked me if my son had it. I was like, I'm sure he has, and I'm Director of Public Health. So yeah, I can understand a lot of people are concerned. I think it's more for children. If somebody's concerned, ring the GP, check the records, and go ahead and have the vaccinations. That's a suggestion. In terms of pop-up centres, yes, there's lots of really good examples. We had some really good ones here. We had a bus in Acton outside Morrison's. We've had it in Southall. We're doing a young people's bus at the moment in near St Mary's that's decked out with alien things, but apparently it's going down really well. I think one of the learnings from us is not so much going out and delivering vaccinations in very small places. Taxi ranks is something that's come up, but more actually going out and doing engagement. So especially with our homeless population, we've done lots and lots of really good joint work with a lot of our homeless charities, trusted people having one-to-one conversations saying there is a centre down the street. We are in such a different place to where we were even a year ago in terms of the vaccination availability. It's not just in one or two big centres now. You've got it in lots and lots of pharmacies, a lot of GP practices. So it's much more embedded. So if we are working with local communities or local groups in need, there is one nearby now. It's not a case of travelling across the borough so much, but yeah, any learning is always good with that. Air quality, I don't know the answer to that in terms of planning guidance. What I do know is that we're doing a lot of work at the moment in the council about the local plan, which is essentially the policy document for the council about its planning policy for the next few years, and we've had a very, very strong health link into that, which has been great. I will check with my colleague about that in terms of the air quality side and see what's coming out of that, but that work is still in progress, so it might not have got to a final stage yet, but we can share that information.
So not going out to virus, but I can speak about air quality from the Acton experience. So we do have guidance around because previously there was no guidance to planning committee and the planning department in respect of air quality. It is there now, but it is guidance at this stage. The local plan will go through the local development advisory committee and through the various shaping Ealing and shaping all the town. I won't name them all, but all the towns of Ealing that is underway at the moment. We can certainly, if the panel is minded, agree to make a recommendation to Councillor Brett as the chair of that committee, but also to the cabinet portfolio holders around giving strong regard to air quality in respect of public health. You know, I can work with you, Councillor Weston, on the phraseology of something like that, but I think it's much wider understood now, the need to protect our residents against those issues, and some of the actions we've taken in the air quality hotspots along the A40 over the last sort of 5 years demonstrate that, but I don't think it's graduated as far down the A40 as Pittshanger, which is obviously an oversight. So we need to reflect that. But I will email you and your colleagues in Pittshanger and indeed the whole panel with regards to some phraseology that we can use. And it would just be a recommendation from this panel It wouldn't carry any, force and effect, but I think it would carry weight in terms of something for the local development advisory committee to look at, and then also for planning to consider as they move forward. Okay, right. I've got Councillor Mattarza, then Mr. Cook, and then I'll check online, and then we'll move on.
Thank you, Chair. One of the advantage or disadvantage of speaking last is that most of the points have already been discussed. So I'll be very brief, and I would like to make few comments, and there might be a little question element in it. Polio virus is, I think, Councillor Rassin has pointed it out. My suggestion would be that we increase the sewerage testing and make sure that the area, Ealing in particular, the reason why I'm saying is that the population we are getting in this area is coming from those countries where the polio unfortunately is still prevalent, and we should not miss the opportunity. Secondly, is there any way we could actually encourage the parents that at least the first 3 lots of polio vaccines should be vaccinated, and like some of the COVID vaccines, if you don't have boosters, you can't fly. So some sort of things which could be attached to the polio vaccinations, and at least first 3 lots of polio vaccines, if that could be given to the families coming especially from abroad. The other items which were mentioned is that we are one of the highest prevalent area in London for diabetes, and I think after Tower Hamlet we are at the highest. And unfortunately, the biggest number of sweet shops are also in our area. So is there anything we can work together from the health, NHS side and public health side to maybe do some awareness walks? And there are certain type of recipes which are used, sugar-free sweets and those kind of things. So this is something which I would like to work with my colleagues for diabetes, and also obesity is another bombshell. We are sitting on it, especially the childhood obesity. Also, one of the items which is tuberculosis in this area, and I assure you that if you go and ask for a BCG vaccine, the waiting time is for nearly a year. We need to upskill the staff who can administer the BCG vaccines and increase the amount of clinics and availability of the BCG vaccines. It is something which very easily can be prevented for the future generations, and I think we should work on that. One more point was COVID vaccine, 30%. I have been involved in COVID vaccinations right from the very earlier on, and one of the things which we missed initially was the big centers, and the logistics was a problem. There were only 2 big centers. One was in Ealing and the other one was in Southall. And my patients from Northolt actually had difficulties coming in, and the logistics was a major issue. I think it's very good that now we have engaged the pharmacies and also the vaccine buses. It has worked very well in Brent Council, and we can actually work on that as well. With regards to the monkeypox, I think it is an identifiable disease, and the health systems don't have this linked into the online identifiable register to Colindale lab. So I think the Ealing practices and primary care workers should have an online access if it is needed to be identified and sent it to Colindale. The last thing is that HIV testing. My personal experience is that it has a slightly socio-economic and legal aspect to it. Once you are tested, somehow the coding system in the different various software systems pick it up automatically. And then if you go to have your insurance, life insurance, even though it is not tested for a particular reason or suspicious of HIV, your insurance policy or your premium will go sky high. So we need to identify and put some filters, especially coding, why the HIV was testing, and it, or at least the patients should be made aware of this fact that this might have an impact in the socioeconomic later on. Thank you.
Thank you, Councillor Mataza. Now, there's quite a lot there, and some of it is well beyond Anna's scope for answering. What I'm going to propose, because there's quite a lot of questions, is that we get some written answers to you and to the panel on all of those points. Because we'll make a note of, and we've got the playback if we haven't made a note of everything. But just in the interest of time, no, it's absolutely right that you should pose it. But actually, I think the most interesting one, from my perspective, was when you talked about COVID vaccinations and the lessons we can learn for future vaccinations and public health engagement with different parts of our diverse community. And you mentioned about how well things have been done in Brent and how well things have been done elsewhere. And this is actually a topic of discussion at the North West London JOSC when we talked about this, and with Pippa Nightingale, who's now the new head, having overseen the COVID vaccination uptick, is now in a senior position within North West London. And it's very interesting how we moved from 2 vaccination centres within Ealing to a more focused approach, but also learning the lessons of Brent very early, having major vaccination sites. Brent having the use of Wembley Stadium, for instance, massively helped in terms of getting people in and out and around. But I think the targeted outreach to different and diverse communities speaks to so much of the work that this panel will do in respect of health inequality, and what you said very passionately about certain parts of Northolt and people getting access as much to information as it is to vaccination. And I don't think anyone would disagree with any of the other points that you made, but I just want to make sure we get the appropriate people to weigh in so we get a full answer on all of those, and we can get that quite quickly for you. We can work that through well in advance of the next meeting. I did have Mr. Cook, who's been very patient by his standards, waiting for me to get through all the other members.
Thank you, Chair. Over the years, we've talked a lot about obesity and its link with deprivation. What this report actually, going forward, doesn't actually really clarify what you intend doing. Is it because it's already a set idea that you've got going forward, and therefore it doesn't need to be mentioned within this report? That's just a clarification.
So I'll take it, because I didn't commission this report, but I gave Anna a steer as to what she should include and what she should leave out. So we are intending, and Councillor Blacker would speak to this if required, we are intending to, as Anna's report mentioned, publish an annual health of the borough report, and within the focus of the administration's priorities is health inequalities and deprivation, and some work around that, and the committee did touch on that last year. So that work is in train, and because we'll be receiving reports on that, I asked Anna to focus more broadly on some of the other items. But the fact that the council's cabinet has a specific portfolio related to health inequality, I think demonstrates just how important this work is and reflects what we've learned out of COVID and before, and in respect of places like Southall and the differences in terms of life chances for people in different parts of the borough and of different ethnicities, that we need to do some major interventions across all areas of the council, not just public health, in order to try and reset that and give people as best a life chance regardless of where they come from. So it's entirely my fault that Anna didn't major on this issue in this presentation, but Anna will tell you, as someone who's passionate about public health, she could major on every area of her portfolio, and then we'd never get to Councillor Blacker and Kerry Stevens, who's waiting very patiently on the screen for us. I do just want to chat, and so we will come to that. And of course, Alan, if you have things to feed in, please do in between the meetings. And I should say as well to new councillors and new colleagues that Anna is also very keen to feed in and provide answers in between meetings, and so are all of our officers and public health partners. Can I just check that I've not ignored anyone online? I haven't even asked anyone online if they've got any questions. So if we could indicate anybody online who's got any questions, or you're happy for me to move on to the next item. I don't know, because we spent some time speaking about this. I'm not seeing any indications, but you're all on mute. So in some cases, what I'll do is if you can put in the chat that you'd like to ask a question, and then we can come back to it, or we can submit questions afterwards for Anna to answer. So on that basis, I'm going to move on to the next item, items on adult social care within Ealing. And this is to set some of the parameters around what we're going to be looking at as a scrutiny panel, because the manifesto commitment of the Labour Party was to fix social care, which is very ambitious, and I hate to put Councillor Blacker on the spot like this, but it is one of our objectives, obviously, to try and look at how best we can satisfy what is only going to be a rising demand for social care. And so it's right that that should be a focus of this panel. We have prepared a couple of reports this evening to speak about that in great detail, but Councillor Josh Blacker, the Cabinet Member for Healthy Lives, is here with us this evening, and he's going to start the discussion with some remarks and perhaps answer some questions.
Thanks, Chair. I'm not going to take too long, and members will hear me at Council next month, where we do the corporate plan about how we kind of operationalise some of these ambitions. And luckily, we've got 4 whole years to fix social care. So, you know, we've got more than the next hour or so. And Kerry's going to take you through some of the details in terms of the reforms we've got to deal with and some of the quality indicators we look at on a kind of regular basis at various kind of meetings, and I hope that you will take an interest in and help scrutinise those indicators as well, to kind of make sure we're delivering the services and the quality of services that we should be. But as Councillor Crawford said, you know, it's an incredibly ambitious 4 years, and some of it is ambition to get back to what we were doing. So, you know, some of the pre-COVID work around better lives, some of the preventative stuff around preventing people going into care homes, the delayed transfers of care work, kind of to get people out of hospital as quickly as possible and re-abled and as quickly as possible. And some of it is new things. So kind of new focus on direct payment users and trying to kind of work out a way for them to, you know, while they are spending money individually, to come together and spend in a mutual cooperative way, and we can facilitate that, and they can co-produce services together that individuals want, but we do it in a way that is efficient and effective for everyone involved. Social isolation, mental health support, and actually looking at what the market is and what the market should be. So Kerry will mention some of the kind of market in stuff we have to do for the reforms, but what are the kinds of organisations we want delivering services in Ealing? And I know the panel will have spoken to the Care Co-op in the past, and we're looking at other forms as well, and whether the council should do our own thing and where that should be and where we can best make an impact in the market. But it is a very ambitious plan, and it is also going to face big challenges ahead. and kind of the first of which will be what Kerry now talks you through in terms of the Health and Care Reform Act, and the impact that will have on us, and the complexities of a market in Ealing that is the shape it is and is provided by the kinds of organisations it's provided by. And, you know, it's the same story we've heard for a number of years, the sheer demand we have. And I'm sure Kerry will mention that that's only going to increase from October next year, annoyingly in a very unpredictable way, because we don't yet know how many people have never come forward who will then be eligible to come forward for our services, for instance. But the market, we're already spending 15% more a day than we were a year ago. So just for context, we are spending £1 million every 4 days on social care in Ealing. And it's a huge amount of money. And that's even before we kind of, you know, feel the real effects of the inflation that is now in double digits. So it's only going to be harder for us to do that. But we've hit the ground running. So Cabinet last month approved £2 million of investment in additional funding for care workers to be paid the living wage. But as I said, and you may have spotted in around Ealing and other places, that's only the start. You know, we think it's about 4.5 million for domiciliary care workers alone to get everyone on the London living wage. So when we are facing double-digit inflation, rising cost, rising demand, finding that money will be a challenge. But we will do it. And hopefully with your support, we can do it, you know, more quickly, more effectively, and we can deliver services in a much better way for our residents and in fact residents from other boroughs who come to us into Ealing for care. Because I think one of the interesting facets about the market in Ealing in care homes is we are a net importer of care home residents, which makes things a bit more complicated when we come to implementing things like the living wage. But that's a conversation we can have over the next few years. I know Kerry's got a lot of slides to get through in terms of some of the details of the reforms, and there's a lot of very colourful charts that you will see in terms of the quality indicators we look at in his second slides. But I think Councillor Crawford was hoping to pause and for me to take any questions you have at this point.
I'm just going to ask if anyone's got any questions based on what Councillor Blacker has laid out. It seems fairly straightforward to me, and would be happy to move on to Kerry's substantive report, but I just wanted to check that there was nothing that anybody wanted to ask at this point specifically around what Councillor Blacker had laid out, and I'm seeing no indications. So Kerry, are you ready, and are you well, first of all? And
I'm well at the moment, thank you, Chair. Thank you for your consideration. So if that's okay to start, Chair,
yes, please, you go ahead.
Thank you for whoever's manning or personing the slides. So as Councillor Blacker has said, there's a significant change in terms of the legislative framework for social care that received royal assent earlier this year. The Health and Care Reform Act is the biggest change to social care legislation since the implementation of the Care Act in 2014. It's the government's attempt to make changes to how social care is provided in light of the significant increases in demand, as Councillor Blacker has referred to. So there are some changes within the Health and Care Reform Act that Anna was referring to earlier in terms of how the NHS is led within the sub-region of Northwest London and the impacts of that on us in Ealing. There are some changes in terms of how the government is aiming to support more people remain in their own homes through support to disabled facilities grants. And there are also some changes within the Health and Care Reform Act and some additional funding around how carers are supported. If you could take us to the next slide, please. As I said, the Care Act, the Health and Care Reform Act received royal assent earlier this year in April, and I'm going to take you on quite a quick tour through the changes and what we've agreed with the Chair and the Co-Chair of the HASP is that we'll provide regular updates to you on progress against this significant and wide-ranging change agenda. Next slide, please. So the Care Act, the Health and Care Reform Act, is focusing on improving quality, choice and accessibility, as I mentioned earlier. There's changes in terms of additional support for disabled facilities grants to support more people remain in their own homes, and also additional support for informal carers who we know support the economy to a huge amount and significantly reduce pressure on social care. There's also additional funding to support with the recruitment and retention of social care staff. As with many sectors within the economy at the moment, there's significant challenges within the sector in terms of recruitment and retention, with large number of frontline staff, around 25% covered by agency staff in Ealing, and also that there's void rates in care home beds, which means that there's a challenge in terms of the staffing of capacity within the care home sector. Next slide, please. So Anna's made some references earlier in terms of the changes to how the NHS system works in nationally, and also the impacts on North West London, the development of the integrated care service board at a North West London level. There are also some changes in terms of how the discharge to assess process will work. This is quite technical, but is how people are assessed prior to being discharged from hospital, and whether a social care assessment is required before the discharge. The Better Care Fund is our joint funding pot that we have with had with Ealing CCG and will have with North West London ICS, and that the Act proposes to create a standalone framework for the Better Care Fund. Better Care Fund is an effective way of ensuring that money remains in Ealing to support the local communities within the borough. But as I say, some of this is quite technical, and we'll bring further updates as the work progresses in the coming months and years. Integration with health, so there's a lot of detail included within the changes to legislation. Duty to cooperate, and as Anna said earlier, we cooperate very closely with our colleagues within the NHS, especially during the COVID pandemic. Focus on collaborative commissioning, so that's moving away from commissioner provider delineations within the NHS. New provisions which will allow NHS bodies to make joint appointments. We're likely to see some of the larger NHS trusts having single chief exec and leadership within their sector. A strong push on data sharing, as we know there's been lots of challenges in terms of NHS single data sets and sharing information within the health and social care system. Patient choice is a key aspect within the changes to the legislation, and obviously this is something that we're closely aligned to within local government. And preferred provider selection, detailed guidance is now due, although that has been delayed in terms of procurement arrangements within the NHS. Main drive throughout the Act is to reduce bureaucracy where possible, and we're working with the NHS to see how this plays through in terms of impact on the national tariffs, which links to the funding for acute trusts and other provider trusts within the sector. Next slide, please. Within adult social care, is a significant change for some of us who are old enough to remember and have been around in social care for long enough. There used to be an inspection programme within adult social care, similar to the Ofsted inspection programme, which is currently in place for children's. The Act is empowering the Care Quality Commission to restart inspection programmes of local authorities in terms of how the services that local councils are providing to the local population, and this will provide greater scrutiny to us within social care in terms of meeting the requirements of the CQC. What we're expecting to do is to bring a programme of work to this board to provide you with the information of the work that we're putting in place in preparation for the Care Quality Commission inspection, and some of the data I'll be sharing with you in the second presentation links to that, and that's ensuring that we're scrutinised by yourselves in terms of our performance. Next slide, please. This is the one that's gaining the most press coverage and the most interest nationally in terms of how people will pay for services. Significant change in terms of how social people who receive social care will be funded to provide support. The main headlines are that no one will have to pay more than 86,000 for their personal care costs. Currently, there is no limit. Individuals with less than 100,000 in savings and assets are likely to be eligible for help from the local council, and that's raising it from a floor of 23,250, where people are eligible for state support. And as Councillor Black was referring to earlier, this is going to see significant increase in numbers of people approaching the council for support with their care and funding their care. We're expecting large numbers, as again Councillor Black mentioned earlier. We're a net importer of people into residential and nursing care placements into Ealing, and we will have statutory responsibilities to fund their care but also to assess their needs. This is a significant piece of work, and it's linked to a market sustainability aspect of the legislation, where the government is making additional funding available to support local authorities fund care providers at a level that will be based on a costed care exercise, which is something that we're working through currently, and I'll provide you further updates. Next slide, please. So this slide Gantt chart sets out the programme of work and the expectations of specific time slots as we go through the change agenda, and I'll liaise with the chair of this meeting to ensure that we bring updates to you all in terms of where we are in terms of the change agenda. So the big ones to watch out for is autumn of 2023, when the changing arrangements will impact on local government. The implementation of the CQC inspection regime begins in April 2023. We're not expecting to be in the first tranche, but we may be. So it's going to be important that we keep you all briefed in terms of our preparation for those changes. The blue line here talks through changes to deprivation of liberty standards. This is where somebody doesn't have capacity to make decisions, and there's a clear legal framework in terms of how we can make decisions on their behalf. So for instance, if someone has a dementia type illness and they're living in a care home and there has to be restrictions put on them to stop them leaving the care home, there's a clear legal framework for doing this. If that's not available, that the deprivation of liberty standards will come to an end in autumn of 2023 and replaced by liberty protection standards, which will modernise the current legal frameworks for those types of restrictions that we put in place on people who aren't capacitous. So, Chair, there's a significant amount of work here. This presentation is to give an initial view on the size of the change agenda. Again, as Councillor Blacker has said, there's a huge amount of challenge within the system. There's financial challenges, there's significant increases on demand, there's the impacts of the cost of living crisis, which will impact on demand, but also impact on the rates that we pay for services. And on top of that, we've got this significant legislative change that that all councils will be required to implement. So what I'm proposing to do is to bring back regular reports to this committee and for you to scrutinise our progress against the action plan. Thank you.
Yeah, thank you, Carrie. I think that's really useful. What I'm going to do, I think you've got some other things to show us. You may not, or maybe surprised, or maybe, yeah, there is another section to the presentation. So it's just whether colleagues have questions now on what's been presented, or whether we want to hold to the other. But Councillor Conti was indicating, so I want to take it. Yeah. Kerry, do you want to do the other part, or am I?
Yeah, thanks. Yeah, happy to do so, Chair. If our colleague can put that up on screen.
Anna Marie, she's getting there. Yeah.
She's a superstar for being able to do.
Yes, but she's also very well supported by Jack Roberts, who's manning the main meeting for us. And without those two, I think I would have blown up the whole council chamber by now in frustration. Yeah, let's here we go.
So if I do a bit of spiel.
Want to start talking through it because we're loading it up now. If you want to, yeah, here we go.
If I start talking, Chair, if that's okay. So as Councillor Backer referred to earlier, the data set that we're sharing with you today is a set of information that's been shared both internally with officers as our performance management framework, but also shared with members where we meet with the cabinet lead for adult social care and also the leader of the council and the chief executive, where we report on our performance on a number of areas so that they can be assured that we are performing and hold us to account in terms of improvements. Thank you very much. So the quality of assurance framework is a development that has been designed to provide as much information and detail to support scrutiny, internal and also with the members of this committee. The information here is correct as of April 2022. So the first slide is a contact and assessment data set. The blue line at the top shows the number of contacts. So this is people making contact with our adult referral centre. So this is our first contact within the organisation. You'll see that there's been a slow trend upwards in terms of the number of people contacting the council for advice and support, and a significant up jumps in January, February, March of 2022. Increased numbers of people contacting the council is not a problem. We'd rather be able to give people information, advice and support to support them remain as independent as possible. And we're very conscious within adult social care that sharing information is part of a preventative agenda. So we do encourage people to contact us. The key trigger for us in terms of demand management is the number of those individuals who proceed from first contact to a referral for a social work assessment. And that is the silvery line at the bottom, which you'll see has remained relatively steady throughout the last 12 months, despite the significant increase in contacts to the organisation. This is a positive move. The contact centre recently, about 12 months ago, moved back into adult social care. So we've got increased number of social workers manning the phones at the front desk to support people with advice and information when they contact us at the council. If the orangey and yellow lines are the targets that are set for us, that we set for ourselves in terms of performance. If I can move on to the next slide. Waiting times for assessment. This is a key indicator in terms of people who come to use our services and their satisfaction. It's absolutely central that we get to speak to people and start completing their assessments as soon as possible, because that means we can prevent any deterioration in their health and well-being. You will see that there's been significant improvements in performance and fairly consistent level of performance over the last 6 months between 45 and 30 days waiting times for assessments to get underway. So I think that's a really good sign of in terms of the quality of the services that we're offering to the local community. Next slide, please. This is the quantum of reviews that are completed each month and throughout the year. Total number of reviews is a useful indicator, but it's not as useful indicator as the waiting times for reviews and people who are outside of our reviews target. Reviews are absolutely key to ensure that the services that we're providing to the local community continue to meet their assessed eligible needs. We know that people's needs change as their health and well-being deteriorates or improves, and it's important that we carry out reviews on a regular basis. Next slide, please. This slide often confuses people. It looks a bit like a ski ramp. This is the cumulative number of admissions to care homes. You'll see that the graph drops off suddenly in March 22, and that's when we started the count again. Prior to the pandemic, we were seeing a reducing number of people moving into care homes as we were supporting people, as Councillor Blacker referred to earlier, via the Better Lives programme to live more independent lives. As the result of the pandemic and the drive to discharge more people from hospital, we've seen a significant increase in the number of people over the age of 65 moving into permanent residential or nursing care placements, and that's a key aspect of the manifesto, but also feeding into the council's work plan. And we're very clear that where possible, we should be supporting more people to live in their own homes, because they have happier, healthier lives generally than in an institution. Next slide, please. As I mentioned earlier, this gives us the number of scheduled reviews which are out of date, so that's 18 months plus. Real concerns in terms of the number of people specifically with learning disabilities and mental health needs who have been waiting for more than 18 months for a review. We've got a targeted work plan to reduce this and significantly increase the number of people that we review on a regular basis. It's important for us as a council and me as the statutory director of the service to know the services that we're providing are meeting people's needs and they're doing it effectively. So this is something that I expect you'll have a keen eye on in the future months as we bring further reports to you and show improved performance in this area. Next slide, please. Again, this is another way of looking at the overdue reviews, and you'll see that we're already starting to see some traction in terms of reducing the outstanding reviews, where it's gone down from 38% to 35%. But this is a real focus for us in adult social care, and it's an area that we've put some additional money in, obviously resources, to reduce waiting times for the reviews. Next slide, please. This gives you an overarching breakdown of referrals that we receive into the service by ethnicity and representation from the different communities that we serve in Ealing. We're doing a piece of work currently looking at how are we serving all the communities in Ealing, and so we hold a huge amount of information about people who receive services, and we will be aiming to bring some of the intelligence within the organisation to say, are the people who access our services representative of the whole community we serve, but also are there areas where we're not providing services and we should be? So I'll keep you briefed and updated as that piece of work progresses. Next slide, please. In terms of the internal assurances that I am provided by my colleagues within the organisation, is we carry out case file audits. These are audits of the social work practice within the council, and these are carried out by managers within the services, and myself and Judith Flinney go through and we audit the auditors, if that makes sense, on a regular basis to ensure that we have a good understanding of the quality of the services that are offered through our social work and occupational therapy teams. Next slide, please. There's some detailed breakdowns here of the outputs of the audits. You'll see that there are a good number of cases that are rated good and outstanding. There's also a number that require improvement or are inadequate. I think it's important that we have a good mix, because it means that we've got our assurance levels set at the right level. If they're all coming out good and outstanding, I'd be concerned that we're not auditing correctly. Next slide, please. There's some examples here of good practice that's coming from the reviews. Next slide, please. Through the audit, sorry. Next slide, please. And the learning's really important. So we're taking the information from the case file audits to improve our practice, and importantly, to change and adapt our training programme for colleagues within the organisation, so that where there are concerns and issues raised through the case file audit, that we feed that back to improve practice across the system as a whole. Next slide, please. And next slide, please. The other area that we focus on, because we commission the large proportion of our services from external providers, the next slides I'll take you through are giving you information and detail of the quality of the care market. Again, as Councillor Blacker was referring to earlier, we have a complex and detailed care market in Ealing. We've got the highest number of care home beds in northwest London. In Ealing, we've got the 5th highest number of care home beds of any borough in the whole of London. We also have a large number of domiciliary care providers that are registered in the borough, not all of whom provide services within Ealing. Next slide, please. This provides you an oversight in terms of the current ratings of care of registered care providers in Ealing, with 61% currently been rated good and 1% rated outstanding. There's a concern in terms of the requires improvement and inadequate rated services within the borough. Currently within Ealing, we will only commission new services for domiciliary care from care providers that are good or outstanding. We think that's a really strong model in terms of driving market quality within the borough. Next slide, please. This provides you some of the detail in terms of the trend analysis that we do within the council in terms of monitoring the quality of provision. And you can see from left to right the progression of some care providers in terms of the quality of the offer that they provide. Next slide, please. These are the mental health and learning disability care homes in the borough, and you can see again a fall off in terms of the quality that's been offered here. Next slide, please. In terms of our maintaining oversight of care providers within the borough, I chair a group which meets with commissioners and other partners within the council to look at the CQC rating and to keep oversight of care providers where there are concerns. So if their care provider is rated inadequate, we would have concerns about that provider and potentially look to move people from that home to another provider, or from that domiciliary care provider to another domiciliary care provider. But we will also have a number of safeguarding processes that we keep oversight of through this process. Next slide, please. Again, more information here in terms of providers that we will spot. I think you've gone, oh no, this is on to, no, sorry, that's right, on to the next one, please. Sorry, Anna Marie. This is the rating of the domiciliary care providers, and you'll see that there's a higher number of good and outstanding providers within the domiciliary care sector compared to the registered care home providers. Next slide, please. And again, please. We also have internal provided services within the council, and these are registered care providers, but also, so we have 3 registered care provisions that we provide directly within the council. We have the short break service, which provides respite breaks for people with learning disabilities, and we have a shared live service, which is equivalent to an adult foster placement scheme registered in the borough, and we also have a registered reablement service, which is registered under domiciliary care. The next few slides provide information in terms of people who use the services satisfaction in terms of the provision that's provided, and we carry out regular fake inspections and audited processes to provide assurance within the service that these registered services are going to meet the CQC programme of inspections. Currently, all of our 3 registered provider services are rated good with the Care Quality Commission, which is something we want to maintain. Anne-Marie, I think you can skip through these because there's some detailed responses here, but I'm sure members of the committee can ask questions afterwards if they wish to. Thank you.
Thank you, Kerry. Great for the detail. Councillor Conte is indicating. I should say, I don't know that I should have declared this at the beginning. I did benefit from a disability facilities grant, which was referenced in Kerry's earlier report. So we may need to amend my declaration to reflect that. Although again, that predated my time as a councillor. Right, questions from members of the panel. Let's start with Councillor Conte and then I'll come to Mr. Cook.
I had a couple of questions. One, some on the first slide and just one on the second pack. In terms of the the cap, the personal care cap that's going up, so no one can pay more, or no one needs to pay more than £86,000. Is that applied retrospectively? So if someone's, I don't know, for example, no. So it's only anyone starting care, then fine. So that's answered my first question. The second one was the sort of demand management. So obviously you said you don't know yet how many people are going to come forward with these changes. I guess just looking obviously at the second set of slides, which looks at the reviews and the delays in some of those, in terms of a plan being put together in terms of how sort of staffing for social care, in terms of dealing with this increased demand is going to be. Obviously, it's a big unknown. Is how are you planning for that? And I guess is that also coming from the £1.63 billion of funding that's coming forward? On the other thing in terms of fees is about top-up fees. So I was listening to something on You and Yours on Radio 4 recently, and it talked about how councils, and it didn't name Ealing, but it talked about a number of councils that are essentially asking families to pay top-up fees and not necessarily giving them all the legal information that's required. The Ombudsman was on the programme saying it's actually widespread practices that councils aren't always necessarily giving families all the information required, and many are paying top-up fees when really they shouldn't be. I was just wondering, what's happening in Ealing in terms of information that's being given to families at the point at which they start social care or are picking the providers. Do we have any sort of barometer if that's an issue? And also, do we keep a record of how many people are paying top-up fees? And because I think that's something else that's picked up in the programme, and that generally is done very poorly, even though it's a statutory requirement. And then just my very final question, which was just about the speed of the catch-up, especially for the learning disability residents in terms of their reviews. Looking at the chart over the last 4 months, it seems even though there's been an improvement, it's going down by about 1% a month. And that means it would probably take years to sort of, to sort of remove the backlog. I was wondering, what's the plan to speed that up?
So I think I'm going to ask Kerry to respond on initially, and then if Councillor Black has anything to feed in, he can do so afterwards. Kerry, you ready?
Thank you, Chair, and thank you for the questions, Councillor Conti. In terms of planning for the demand, it's going to be inordinately challenging. It's recognised that within the care sector, recruitment and retention of staff is very difficult. Currently, we're looking at a number of programmes to look at. One, what do we think the demand is going to be? Not all self-funders are going to want to come to the state to receive support. There'll be a proportion who wish to remain self-funding and to retain that control over their lives. We do have data on the number of self-funders within the borough, and the Association of Directors of Adult Social Care and Local Government Association have come up with a very creative 80-20 split on the assumptions you can make about who will and who won't come to adult social care. So we're preparing for the worst. We're looking at a number of ways that we can support people make their applications for support from the council more readily, such as electronic ways of completing the Care Act assessments. Are there ways that we can consider, if somebody's been in a care home for 5 years, that we make an assumption about their Care Act eligibility, those sorts of things. So we're working through that, Councillor Conte, but the demand is going to be very, very challenging, and finding the right people to support us deal with that initial surge in demand in the next 6 to 12 months is going to be significant. In terms of top-up fees, we do keep a record of top-up fees. There's very clear legal framework within social care about who can and cannot be charged a top-up fee. As you can imagine, with any market, you can pay as much as you like for a service, and the legislative framework does allow councils to charge a top-up if an individual's needs could be met more cost-effectively elsewhere. We do keep a record of that, and if you'd like, Councillor Conti, I can go away and get the information for you and provide that to you. In terms of the catch-up work around reviews, this is a significant area of focus for us. We've got additional resources who've been going into the service for I think it's the last 6 or 8 weeks. We want to see more improvements. I think as part of the CQC inspection preparation, if I were a CQC inspection looking at these stats, this would be a strong area of focus for me. So this is something that we're working very hard on. As you can imagine, over the last 2 years, it's been difficult to carry out reviews of people in receipt of services, especially people with learning disabilities, where it's important that we engage them in the review process and their reassessment, but also that we know that we've got a lot of people that are placed outside of London, and there's a lot of travel involved in terms of carrying out those reviews. So we will keep you briefed on this, and I provide you assurance that we're working on bringing down the number of reviews which are outside of our target area.
Sure. So thank you, Kerry. And Councillor Conti was indicating that he would like some of that information, or all of that information, to be provided. So if we could provide that to the panel.
The top-up fee stuff in particular.
Yes, on the top-up fee in particular. But I think there's some more information that Kerry can provide in all areas, and as previously, he's endeavoured to do that. So we'll make sure. I'm not seeing that Councillor Blacker wants to come. Do you? Yeah, go on.
Sorry, it's a lingering post-COVID cough. No, I think just important also just to remember when we're talking about the care cap, there are some costs that don't count towards that. Just members' awareness. So if you're in a residential care home, your kind of meal costs and things are not covered under the care cap. So there are costs that people still won't go onto that. And it's implementation of that and the care account that we've received some funding for. And I think I'm particularly concerned that that's not enough to meet the very complex challenge that is going to pose in capturing costs and keeping track of it and then hitting the cap. So yes, it forms part of that funding, but we're not seeing very much of it.
Yeah, and I think that was the point I was going to make, which is, as ever with these things, I mean, this has been a significantly underfunded area for some time, and it's clear that the funding that's potentially to roll forward comes with extra responsibilities for local authorities, and it's going to be very difficult to meet all of those. But I am confident in my questioning of Kerry and his colleagues that they have some innovative ways of looking at doing this. Certainly the LGA assessments and the ADAS assessments are interesting, and projections moving forward. So it gives us an idea of what Kerry was speaking about, which is the worst case scenario. And obviously I think the plan for us as a scrutiny panel is to keep this under review, keep looking at it, but also to empower councillors with the ability to advise and support their residents, because I think this is something, if it isn't already coming through at your surgeries or in your discussions with residents, it certainly will be, because just a larger number of older residents are going to elect to come into this system, and they may not even elect to. It may just be something that happens, unfortunately. Right, I've got Mr. Cook, and then we'll go to Councillor Weston.
Thank you, Chair. Looking at this report, I'm very disappointed with the actual dashboard at the end, which talks about the CQC inspections. The fact that there are so many inspections within the last period of time where you've actually got requires improvements, and in some cases, in one particular case, the last 5 inspections have all required improvement. And if you look at across the adult dementia care homes, you look at mental health, you look at domiciliary care, there is actually quite a lot of places that actually do not come up to standard. And what I'm wondering is what are the council going to do going forward to actually, can they insist on improvements in the process? You know, if somebody has, you said about being inadequate and you then take people away from them, you don't recommend the care. But what happens to an institution that's actually had 5 repetitive over time requires improvements and nothing's happened? That's the big concern, is that yes, we're getting these CQC reports, but my big fear is nothing's actually happening to make the improvements which actually as a member of the public, I would expect if one of my relatives was in using these establishments, I would expect much better. And I know, for instance, there are several cases, there's one particular case I know of that's coming up fairly soon, where people have actually made complaints and nothing's ever happened.
So part of this is the regulatory framework, as I'm sure Kerry will speak to in a moment, but I did want to get in before that. It is an issue with the current operation of the regulatory framework, which means that the action that we would seek in these cases is often delayed, and councils can't insist immediately on action to be taken. And that's why I think, as both Kerry and Councillor Blacker have indicated, that they only seek to commission services from providers that meet very high standards. Now, Kerry will speak in broader terms to answer your question, but I think it's important to say that on receipt of this report, and indeed in the commissioning of this report, we were asking those very questions. Kerry?
Thank you, and thank you for the question, Mr. Cook. As Councillor Crawford has said, the marketplace for care provision in Ealing is challenging, and it's dealt with through the Care Quality Commission's statutory framework for assessing quality and rating providers. The concern is a significant concern. It's not just an Ealing concern. This is London-wide, and particularly North West London has had some significant challenges in the quality of the services provided. Ealing Council has taken is the largest commissioner of services of domiciliary care in the borough, and I think it's a very clear and definitive step that we took a couple of years ago to only procure services from new services from home care providers that are good and outstanding. And we see that as a way of driving the market sector and improving the offer for people who use our services, but also for the wider community, because it drives up the quality of the offer from domiciliary care providers. In terms of the interventions that we're putting in place for the care home sector, we've got a newly developed training program that we've been working with integrated care partnership colleagues on a borough-based level that's being provided within the care home sector, which will hopefully improve the quality of the care that's being provided within those care homes, and thereby drive up the quality of the inspection outputs from CQC. There are some vagaries in terms of the inspection programme over the last 2 years in terms of CQC not visiting or completing inspections of care providers. This was done remotely, and the number of inspections are starting to increase within the community providers and the care home providers, and we're waiting to see what the product of that is as the inspection programme starts to bite.
Thank you. And I think it's something we'll return to on, we're going to have specific reports around this. And I know Councillor Steed and I have discussed the need to examine the care market in detail. And I know it's been a consideration of yours, Alan, for some time. So, you know, we'll leave no stone unturned in that. I've got Councillor Weston, and I'm going to move to people online, and then Councillor Steed.
Thanks very much for the presentation. I'm actually picking up where Mr. Cook left off, because I was very concerned about the repeat RI judgments as well. Linked to that, I think for me, in terms of the QA framework, and somebody who sits within a quality improvement department currently, I would say for me there's something probably missing about complaints from people who use the services that we commission, and I think it'd be really helpful moving forward if we could get some of the sort of higher level analysis around some of the trends from those complaints and the actions taken. I don't very often have anything positive to say about the former Health Secretary, Jeremy Hunt, but one of the things that he's commended in his book is the notion that those people that are involved in the design and delivery of care services should at least look at one complaint per day because it provides context. So it's something that I would sort of commend to others to follow suit in. I think I also wanted to just raise a couple more things. I think it's great that now the CQC are finally fulfilling what I think has been its role for quite some time and looking at local authority provision. I suppose for me, moving forward, what I'd like to see is a kind of honest and frank self-assessment of where we're at as a council and have the opportunity to comment on that. And then finally, just in terms of the changes to legislation, the big thing, which I think is a missed opportunity for the government, is around continuing healthcare eligibility criteria. It's not something that was in scope as part of the legislative changes. And I'm aware of people that have received confirmation of funding after their loved ones have passed away. I think I would like to understand, particularly with the move to integrated care systems, how the whole issue of CHC in Ealing works, because it's an area of sort of great passion for me personally.
Thank you, Councillor Weston. Just before I bring Kerry in, we did take reports on, and we do table in reports on complaints for social services. We have done that as part of the work programme previously. Previously, when Councillor Blacker was chair of the Overview and Scrutiny Committee, those reports were taken by the Overview and Scrutiny Committee, at least, and there is an independent process for complaints that goes through. But I'm sure that Kerry, and he's been very clear since he's taken over as the Director of Adult Social Care, can share that information to you presently and as soon as possible. Just on the former health secretary, it'd be remiss of me not to point out, I wish he had taken note of the residents of this borough's complaints around shaping a healthier future more sooner than his government did, because we would have saved about £90 million. But there we go. I can say that because I'm the chair. I'm now going to hand over to the officer for the straight-laced answer to your question.
Thank you very much, Chair. I appreciate that. In terms of, and they're really good questions, Councillor Wesson. So we do produce internal complaints data, and that will be part of the quality assurance framework going forward, but that's for council provided services. Complaints that are made to externally commissioned providers are made to those providers, and it's difficult for us to collate all of that information. That information would generally be held and influence the CQC inspection outputs. I'll speak to my colleague Gordon Crichton, who knows all on this subject, but I'll double check that for you. But we certainly expect to see more internal complaints data in future presentations around the quality assurance framework. In terms of CQC, I think it is important. It will drive performance across the sector in terms of local government quality issues, and I think sharpen everybody's minds. I think in Ealing we had been developing an internal quality assurance framework prior to the announcement about the inspection programme for local council services. But I think it's a really good point, and it's important that we're held to account for the services that we provide. We provide services to a good number of people within the borough, over 3,000 people, and it's important that we're accountable for how we support those individuals within the community. In terms of continuing healthcare, I'm glad I've got a kindred spirit who's very interested in continuing healthcare performance. We gather lots of data on this and hold colleagues within the North West London NHS to account in terms of performance. I've got lots of data on this if you'd like me to share it with you, which shows comparative data in terms of number of applications per head of population CHC eligibility. There are some significant variations. If you live in an inner London borough in North West London, you're more likely to be eligible for continuing healthcare than if you live in an outer London borough. And there's no good health reason for that other than the populations and how able they are to lobby for additional NHS funding. So I can certainly share that with you, Councillor Weston, and more widely if requested.
Thank you, Kerry. Councillor Weston is nodding, and it's remiss of me not to mention that some of this information is discussed at the JOSC as well on a North West London level. So what we'll do is we'll prepare various selections of information for you and the whole panel, and then we'll revisit between the meetings what else you might like, and I'm sure Gordon Crichton Reference would be happy to meet with you individually, or if you'd find that useful. Councillor Blacker wanted to come in as well.
Yeah, just picking up on the CQC point and the internal work that we've done, we did commission an external review to come in and do a kind of light touch kind of, you know, faux inspection, which included interviews with myself and with the leader as portfolio holder and the leader of the council, to, as CQC would, as Ofsted do. So we have done that work. There is an action plan arising from that. I would have thought had it not come to health scrutiny before? If not, I'm sure we can share it and kind of get some feedback on the actions that were proposed and that we're taking as a result.
I think it's not come here formally because it was in being drawn up through the pre-election, post-election period, and we haven't had an opportunity. It's certainly been alluded to in Kerry's previous reports, but I don't think it's come here for scrutiny. You know, again, that's something we can circulate and then add into the work programme where necessary, I think. Right. Now I need to check. Councillor Alexander, I saw your hand was raised, but it's gone down again. Do you want to come in at this point?
I think my question was kind of answered really in terms of, sorry, can you hear my fan now? Do you
Yeah, we can. Keep going.
In terms of quality assurance, in terms of the care homes, I was just wondering, do care homes do peer reviews themselves, so that, for example, the outstanding care homes, do they go and support other care homes and you know, show them good practice?
It's a very good question. I'm not sure that it widely happens, but Kerry will give you the answer.
It's an absolutely valid point. The difficulty we have is that the care homes in the borough are provided by a myriad of different providers and different organisations. What we're doing is, through the initial training programme that we're rolling out within the care sector currently, is that there'll be opportunities to share best practice within that, but it's certainly something I'll take away, Councillor Alexander, and discuss it with my commissioning team, see if there's opportunities there.
It's definitely one we can look at a structure of how that might work, I think. Councillor Steed.
Yeah, very briefly, Chair. Thank you. Just to express the support for what Mr. Cook was saying and Councillor Weston on the various concerns on the tables that we've been presented with. And this has kind of come up, I think, in various different ways, but there's no benchmarking figures we have in the report, and I appreciate the potential issues with somewhat simplified benchmarking figures, but even so, I think it might be useful if they exist, if we could have some.
It's something we talked about at the pre-meeting in terms of benchmarking. With difficulty we've got with benchmarking is obviously every local authority is different in how they commission services. Every local authority is different in who presents to need these services and in terms of their makeup. But I think in terms of the sort of West London Alliance, North West London neighbours, there is a way of doing it. It's something that I've discussed informally with Kerry, so I don't intend to put him on the spot right now and make him answer. You want to, though? Go on.
I always love answering questions, Councillor Crawford. I think it's a really valid question. We gather data through a number of formats for national reporting for the Adult Social Care Performance Report, which we call ASCOF, and the Services for Adults a collection of data which we call the SALT report. These do provide comparative data both regionally and nationally in terms of how we perform compared to other geographically co-located boroughs, but also with similar population distributions as we have in Ealing. And there's some really useful and beneficial information there. The next data set is expected in the autumn, and we can bring a report to this committee to update on that comparative data at that point. I think it's a really important part of the scrutiny process that we're held to account of where we're lagging behind similar boroughs.
Yeah, absolutely. So I think we'll take that report. It's a question of where we take it. Right, before I bring in Councillor Mataza, who's going to be the last councillor, we do have Roy Willis from ERSCAG, Ealing Reclaim Social Care Action Group, who has notified us in advance that he has at least 3 questions to ask. And Roy should be with us and ready to ask his questions. Yeah, he's coming up on my screen now. Roy, when you're ready to ask your questions, please go ahead.
Thank you, Councillor Crawford. Can you hear me?
Yes, we can, loud and clear.
Good, okay. Well, I'm pleased to be able to ask these questions, although some of it's been covered already, by the questions from some of our new councillors and members of the panel. I'd just like to say to them that obviously I'm asking these questions tonight on behalf of our organisation, which is a small independent campaigning group campaigning to improve social care and transform social care so that it empowers people to get involved in planning and in designing their own care. So we're involved with people who've been involved in social care in their career, in their previous careers. We're also involved with some carers who are family carers who keep the service running and keep lots of services being provided by voluntary carers. And also we also are involved with some service users, particularly those from the direct payments user group, and that they also provide us with some of these questions and some of these comments. So just quickly on probably in terms of the work program, we'd like to ask if given the severe cost of living increases for everyone, should the scrutiny panel monitor the number of social care users in arrears or in debt because of being unable to pay their care charges at a time of other pressures on their household budget? There's a concern that some carers and some service users are reducing or cancelling their care services because of these financial pressures, and that this puts extra pressure, extra stress on those hard-pressed carers. I'll move on to the second question, yeah?
Yeah, please, if you ask them all at once, Roy, and then we can get the answers.
Okay. Well, the second question's been largely answered already. It's about the 35% of reviews that are overdue by at least 18 months. And noting obviously that it's even higher than that in learning disabilities and mental health. And I understand there's a plan to tackle this backlog, but no details really been given about how that's going to happen and when it's going to happen. So I don't know if there's anything that Kerry might want to add to that. But the third question also has been sort of mentioned. It's about the working relationship between social services and the Care Quality Commission. I'd like to be reassured that the Care Quality Commission is involved again, because they were the sort of missing in action during the COVID crisis. And it seems to be shown up by this issue of domiciliary care providers. I think there's 34 of them listed in the report, but only 3 have been inspected by CQC since March 22. And several of these care agencies don't appear to have been inspected since 2018. So I'm just commenting that this system of regulation seems to be rather haphazard for such a key service. And can we be reassured that issues such as staff shortages, poor training, lack of supervision, etc., in these care agencies are being addressed properly if these agencies haven't been inspected since 2018? What are the borough doing in order to try and improve the service?
Okay, so thanks, Roy. So before Kerry answers, which he will, because he's indicated that he wants to. On the first question, Kerry's already indicated to me that he'd be happy to provide some information and get that to yourself as well as to panel members with regards to the financial issues for carers and family members who are supporting family members and adjusting their care packages and what can be done in respect of that. You know, we do keep those cases under review, and I don't want to speak for Councillor Blacker, but I know that the administration wants to support as many people to access the right packages of care that they can. And that's actually one of the issues with the review backlog, is trying to make sure that every individual's assessed need is met, and where the assessed needs are not adequately assessed, or where those needs have changed as a result of the pandemic, or changes to disability or learning difficulties or anything like that. It's about trying to make sure that we capture that information as accurately as possible. And you will know, as I do, that's a very challenging thing to do for people with disabilities, because no day is the same for anybody with a disability. You can have a good day, you can have a bad day, and then on your bad day, that can roll into a profound difference in how you may want to access a service in future. So I was just trying to reassure you on point number one that we will, or question number one, forgive me, that we will take a look at that. And we've tackled questions 2 and 3 to some degree. What I would say on 3 is my answer to that is I would want to write, and I would seek the panel's approval, and I will do in a minute, to write to the Care Quality Commission about what they're planning to do and how they're planning to do this, because it's very difficult for Kerry as an officer to say what I'm about to say as a politician, which is that I agree with you, and I've expressed some frustration already with regards to how the CQC has gone about doing this. The new arrangements that Kerry outlined in the presentation when they come in will actually give us a clearer picture of both the market and the position for the local authority in terms of our service provision and what we commission. And we will have a better picture once that legislation is enacted and we're opting to go that way. But in the sort of interregnum, we need to make sure that everything is being done to live up to what we need to do for those vulnerable residents. And finally, what I would say is I learned a lot from going and meeting with ERSCAG and its representative when I took over chairing this panel. I would recommend that colleagues individually speak to Roy and Maggie and colleagues within ERSCAG about going to visit or having an opportunity to meet with ERSCAG to talk about individual cases, to understand their work. Because what I've tried to do as chair is have them as involved in this panel as possible. But it's really good for new colleagues to know precisely what they're campaigning about, what their issues are, and have confidence that they feel that they can report into you as well as me, as well as Councillor Blacker, the leader of the council, and the officers of the council. And with that, I'll hand over to Kerry to answer all of the questions. Sorry, Kerry.
Thank you, Chair. I think you've covered quite a lot of it already, Councillor Crawford. In terms of debt, we can provide updated information on a regular basis in terms of the number and value of the debt that is moving into a troublesome position in terms of recovery for the council. So we'll be happy to share that. Just to say that Councillor Steve Donnelly attended the meeting with myself and one of the colleagues from the finance debt recovery team last week, so we could review the debt recovery processes with him to provide him with assurance that we're treating the communities who use our services fairly, but also that we're being clear that we're recovering debt where there are debts owed to the council. In terms of the reviews, absolutely correct, Roy. We need to provide you with assurance that we're progressing on this area, and that's something that I hope to do going forward. In terms of CQC and the relationship with CQC, we have a strong local relationship with CQC. They attend our risk assessment panel where we have oversight of providers where there are concerns in the borough, and we have a good relationship with the local officers of CQC, and I think it's important that we do that because we do a lot of very close working with them. Nationally, it's more challenging. Nationally, they're setting their expectations in terms of when inspection programs are being restarted and who will be prioritised. So I think that some of that gets quite political, but I'd support Councillor Crawford if he needs any support in terms of drafting a letter to CQC and setting out some of the background information in terms of what has and hasn't even been inspected over the last 2 years. Thank you.
Thank you, Kerry. So I'll take your advice on that, but I think it may be worth writing a letter. But I'll share the letter with the panel and with the and with colleagues. Yeah, Roy is saying that ERSCAG are very willing to meet with individual panel members. They've met with many of us previously, and yeah, more involvement of carers and service users is essential in terms of fixing social care. Yeah, I don't think everyone is nodding, as is Councillor Blacker. I don't think anyone would disassociate themselves from those remarks that you've made, Roy, and we look forward to certainly continuing to have your input throughout the year of this panel, and I would recommend to all my colleagues that they meet with you, and I'd be happy to attend as many of those meetings or speak at your meetings if you think that would be appropriate. So I hope you feel those questions have been answered, but of course, if not, do send me an email and we'll get to the finer points of it. I've got Councillor Mataza, and then I'm going to move on to some recommendations based on what we've heard. Councillor Mataza.
I can see how interested everybody is to listen to me, but a quick few personal comments, which I would like to make. Thank you, Roy. CQC has already started visiting in the last 2-3 weeks. I have been facing 2 CQC visits myself. So they are doing, and one of the searches they are doing it is they are particularly looking into the LD and mental health reviews. So that will help in improving the number. Secondly, I'd be interested to know, particularly with the institution, residential homes and nursing homes, how much the difference, and if I could get the analysis, how many complaints are against the social services and how many complaints are against the health providers, because as my understanding is that the commissioned services, the health services were commissioned on a separate basis, and they are not particular with the GPs. So I'd be interested to know how much is overlap. And the third is that we need to have a structured pre-discharge, pre-hospital discharge meetings, maybe hybrid or Zoom meetings between the care coordinators, and now we have recently appointed the PCN social prescribers. That will avoid a prolonged stay in the hospital and post-discharge patient experiences, bad experiences. Thank you.
Yeah, so I'll bring Kerry in shortly. So the breakdowns are available in terms of when we get complaints through, and that's normally an independent process. But I'm sure, in respect of not resigning from what Kerry said in response to Councillor Weston's questions, we can provide that information. Whether it's quite as detailed as you would like, we'll see. But I know Kerry will try and do that. And just on this delayed transfers of care, this was a key focus for the council prior to the COVID pandemic, and indeed what happened during the COVID pandemic, as I'm sure you're aware, with regards to people being released into or transferred into care homes at times when it was completely inappropriate for them to be be sent into those settings has only heightened that need for greater links. So yes, it's great that we've got social prescribers and everybody round the table again and ready to be involved in that. And I do think some of the new networks will help, but it was a key focus for Kerry, his predecessors, and indeed all of the NHS officers. So I think that work will continue. It's just a question of where we can add value in this instance. Yourself as a counsellor, as a GP, can feed in your expertise, but I think there are always ways for local counsellors and community leaders to feed into this process, because as you both, as you know, and Councillor Conti will know, there are lots of things that are written down in terms of instructions for health professionals, but the actual reality of complex cases is sometimes it's difficult to follow all of that to the letter, and every individual case is different. And with the pressures that people are put under, we can't always, although we aspire to best practice, it's not always deliverable. So I think that's important. And I'll stop talking like a politician now, and Kerry can actually answer.
Thank you, Chair, and thank you for the questions, Councillor. In terms of gathering the complaints data from an NHS and a local government database, this is something we've been looking at specifically where there are concerns about the quality of care by certain providers. Again, I'll liaise with my commissioning colleagues to see what information we can delineate between the routes of where the complaints came from. In terms of the CQC inspection programme, I think as the programme starts to ramp up both the programme of inspections of registered care providers, and that includes NHS providers, but also of local government, we'll start to see trends in terms of areas of focus where CQC are particularly interested in wanting to drive and influence practice, and that will come to the fore. And I think, yeah, we'll provide you the data as soon as we can on the complaints if that is available. Thank you for the questions.
And thank you, Kerry, for your steering us through what is a very complex area and will be very challenging in terms of implementing those demands from the impending legislation. And I would like to say I appreciate your candour and your commitment to pre-scrutiny and involving the scrutiny panel in this, because it's difficult enough to provide the information to Cabinet colleagues and get it into Cabinet reports and drive that process forward. But I think I speak for everybody in saying that we're really pleased to have such a strong relationship with the Director of Social Care, who's willing to discuss these issues at an early stage and notify us of concerns so that we can factor it into the work programme. Right, I'm going to briefly run through a summary of what's been discussed and what feel like appropriate recommendations, and ask colleagues to either add to or agree. So we've had some discussion about complaints and that voice of the service users and their families being reflected in the process, and I think we've heard from Kerry a commitment to try and do that where appropriate and where possible. We've also heard from a couple of colleagues about benchmarking in terms of giving an accurate position of where we are as a local authority in comparison to neighbours, and there are also specific asks in respect of the CQC inspection agenda that we can all take forward. I think there was sort of unanimity around all three of those. We heard earlier from both Councillor Blacker and Kerry about managing the current position with regards to adult social care, both in terms of the number of people who are presenting for use of the service, the amount of money that the council is spending, and also the reviews and the current lag for people who are wanting to either get themselves reviewed for the first time after a referral or get those needs reassessed. And Councillor Conti pointed out at the beginning of what felt like the beginning of the meeting a long time ago, the gap between and how we address that gap and how we bring it down and get to a better system. And everybody, I think, indicated assent as to wanting to do that. What I would say on that particular point is there have been a series of programs around that, and there was a some work done by one of Kerry's colleagues, Adeniki, who looked at changing the culture in terms of some of our social services reviews. It predated the pandemic, but a lot of that learning is now being embedded into how we redesign the service, which is why I'm so excited about the ability to examine this in detail going forward. And then before I'm going to be very cheeky as the chair and use my prerogative here, two of the councils that have successfully redesigned services and now perform very strongly, the London Borough of Hampstead and Fulham and Wolverhampton City Council, the precursor to them redesigning their services was, in both cases, they adopted the social model of disability to reconfigure their services around disabled and elderly people and the needs of those people, and make sure that they were prevalent in how the services were redesigned. And I think as a starting point for discussion in this area, we should look at whether that is possible, not immediately, because it would take some designing, but when we come to the end of our work as end of this municipal year, I would think that would be a strong recommendation for the cabinet or whomever to consider about putting that voice of service users, families, carers, unpaid carers in particular, right at the heart of what we look to do. Because as Councillor Blacker outlined, this is not a one-year programme, and it would be foolish to say that it was a one-year programme. It's an aspiration over 4 years to change how we deliver these services. And that's why I propose to add that to recommendations at this stage. But I've asked you for, that's 1, 2, 3, 4, 5, 6, 7 recommendations already, and I've not asked anyone if they agree with them. So let's see if colleagues have anything to add in terms of recommendations, and then I'll ask Councillor Blacker if he wants to make any concluding comments. Councillor Weston to start with, yeah.
My only observation about recommendations is generally it's good to keep them to a minimum and for them to be sort of high impact related recommendations. So I just wonder if there's any scope for us to group some of those things together, perhaps.
There absolutely is. What I was trying to do was just merely reflect the discussion that we've had so that everything is captured. And in terms of the final recommendations that we will make as a panel at the end of the process, they'll absolutely be grouped together to make sure. But this is both a combination of recommendations and sort of points for the next meeting that I don't miss in my discussions with Kerry. Can I just check that no one online has got anything they want to add at this point? Thanks, Jack. I'm not seeing anybody there. Well, I am seeing you all, but you're not indicating to me. I need to be clear about that. So I'm going to come to Councillor Blacker if he wants to make any concluding remarks on what he's heard, and I'll make sure Kerry is part of that process as well. So Councillor Blacker.
Thanks, Chair. I mean, just on that final recommendation around embedding the user voice, I mean, I don't think you need to make that. I think what you need to do is hold us to account for the promise that we will be doing that. If that helps trim the recommendation somewhat. So it's precisely what we are setting out to do. And we can talk to you more about partnership boards and how we do that over the coming months. And Kerry is very helpfully nodding, so I haven't even got it wrong. Thanks. It's a really interesting discussion, and it's really useful to be here and get some of that steer from you and members in terms of what you want to look at and the kind of questions you want to ask. We do aspire to be an open and transparent administration, as you know. And the candor of some of the data we presented is part of that, and actually saying, ask us these questions and make it better. And I think the idea of putting complaints numbers into that quality assurance dashboard is a good one. It as Kerry says, we'll post some challenges in terms of where we can do complaints. We can only use ours, but is a really good one. It is a 4-year process. It's going to be difficult. I think some of the comments about the number of requires improvement providers, just tells you how broken the market is, right? It's social care is broken. We will do our best to fix it, and we will do that with your help and support and I dare I say challenge as well. But thank you very much.
Thanks, Councillor Blacker. Kerry, was there anything because I made a lot of statements there.
No, I think Councillor Black is absolutely correct. I think the engagement with the local communities who either use our services or will use our services is something we've got a clear programme of partnership boards that we're reviewing to make sure that we maximise engagement with the community. And I think that being open, transparent, I think in last year's programme we brought a number of reports here through partnership with colleagues at Health Watch that were quite challenging and certainly weren't something that other boroughs had done in terms of the impact of COVID. So I hope we continue to have this scrutiny process because it can only help us improve the quality of services we provide.
Yeah, absolutely. I'd commend, and I said this at the last meeting, I was very sceptical about Health Watch at the beginning, as Mr. Cook and colleagues know, and I've had to revise my opinion given the quality of the work that they've undertaken and done. Now, what I'm going to do, Councillor Blacker, I will make sure that the minutes reflect that I suggested this and that you said that that's what you want to do. So it probably won't be a formal recommendation, but we'll note that it's an aspiration of the administration, if that's okay. And perhaps we revisit at the end of the year the best way in which you can do that. And as always, we make recommendations. It's for the cabinet to decide whether those recommendations are appropriate or not. But in reflecting Councillor Weston's caution, if you like, that we don't want to make too many recommendations and leave you sort of with so much to implement. We do recognise the benefit of this scrutiny process, and it's very valuable that Kerry and his team are willing to invest so much time in coming to us and discussing these issues. It's just about where we can add value. So absolutely, that's a reflection for me and Councillor Steed and all colleagues. Right, before I wrap up the meeting, I neglected to tell you about various training opportunities earlier on, including one tomorrow night, a scrutiny session that is online, run by the Centre for Public Scrutiny, which starts at 7 p.m. And will be very useful for anyone who it's run by an outside external provider, and they are very good. And that gives us some ideas about what represents effective scrutiny. And I will be making my best effort to attend that. There is also a session on the 5th of July, am I correct, in regards to this very area of healthy lives, which will take in some input both from council representatives, officers, and hopefully the NHS as well, and give you some overview of these areas that we're looking at. But it will be informal and headline overview, but it should complement some of the things we've discussed tonight. And with all of that being said, the next meeting is sometime in September, the 20th. Yes, thank you very much to everybody for their contributions tonight. I hope it's been useful.